Best Telemedicine Software of 2026. Welcome to part 3 of our 10-part series on the best healthcare software in 2026. In this episode, it's all about telemedicine software. We'll cover what actually matters in this category, as well as some of the best platforms for small practices, mid-market, and enterprise health systems. Before we dive in, this video is sponsored by several healthcare software leaders, including our title sponsor, athenahealth, as well as our other sponsors and partners, NextGen, drchrono, CareCloud, and TotalMD. What a stellar group of platforms. You can learn more about each of them through the links in the description. Alright, let's dive in. Best telemedicine software for small practices. For small practices, telemedicine is about adding access and convenience without adding complexity. The goal is to offer virtual visits alongside in-person care in a way the front desk can manage, clinicians can document quickly, and patients can navigate without calling for help. The best small practice telemedicine platforms work within your existing workflow. Patients should be able to book virtual appointments the same way they book in-person ones, ideally through your existing portal. Integrate with your EHR. Clinical documentation from virtual visits should land in the same patient chart as in-person notes, not in a separate system. Handle billing for telehealth codes automatically. CPT codes for telemedicine, payer-specific telehealth policies, and state telehealth parity law compliance should be managed by the platform, not your billing staff. Be reliable for patients with varying technology. Patients should be able to join via a browser link without downloading an app, and the connection should be stable. Offer automated visit reminders. Patients forget appointments and struggle with technology. Automated reminders with a single click join link dramatically reduce no-shows. Prioritize compliance. The platform must be fully HIPAA compliant with business associate agreements, not a consumer video tool with a BAA tacked on. Here are several telemedicine platforms consistently chosen by smaller practices. Note, these are listed alphabetically. I won't read through every single one because we have a lot more to cover, but I recommend taking a screenshot and returning to this list later, then setting up demos. There are also links in the description for detailed feature breakdowns in the SelectHub platform. There you go, some of the best telemedicine options for smaller practices. Before we move on, a quick shout out to our title sponsor, athenahealth. Unlike systems that bolt together separate modules, athenahealth, whose Athena One solution provides EHR, practice management, and revenue cycle management, serves medical practices and health systems in one unified system. Their single instance network of over 170,000 clinicians and 117 million patients gives them a scale that's hard to match in ambulatory care. Plus, Athena One is AI native from the ground up. The platform brings AI into the workflows that power ambulatory care, helping practices deliver care, manage revenue, engage patients, and run more consistent day-to-day operations through one connected platform. Thanks to athenahealth for supporting this series. Check them out through the link in the description to see if Athena One is the right fit for your organization. Now, back to the show. Best telemedicine platforms for mid-market organizations. Mid-market healthcare organizations adding telemedicine need platforms that can handle volume, manage multiple provider workflows simultaneously, and integrate deeply with existing clinical and administrative systems. Mid-market telemedicine buyers typically look for multi-provider and multi-location support, the ability to manage virtual visit capacity across providers and sites with centralized scheduling and provider availability management, asynchronous care capabilities, store and forward workflows for specialties like dermatology, radiology, and behavioral health where synchronous video isn't necessary, remote patient monitoring integration, devices that capture blood pressure, glucose, weight, or other biometrics outside the clinical setting, feeding data directly into the care platform for clinician review, payer contracting and billing support. As telehealth payer policies continue to evolve, platforms that stay current with coverage rules, place of service codes, and state-specific requirements protect revenue, analytics and utilization reporting, virtual visit time, no-show rates, provider utilization, payer mix for telehealth, and patient satisfaction data that help administrators manage the virtual care program. Here are several platforms often chosen by mid-market organizations. Again, screenshot this list, and there are also links in the description for SelectHub's feature-by-feature comparisons and analyst scores. Our analysts have reviewed popular telemedicine platforms in depth. Links to the SelectHub platform in the description. Best telehealth platforms for enterprise health systems. Enterprise health systems running telemedicine programs at scale need platforms that can handle tens of thousands of virtual encounters per month, integrate with complex EHR environments, and support diverse care delivery models across the full spectrum of clinical services. Enterprise telemedicine platforms need to support enterprise EHR integration, bidirectional real-time data exchange with Epic, Oracle Health, or other enterprise EHRs, so virtual care is fully embedded in the patient record, on-demand and scheduled care models, both urgent care style on-demand access and scheduled specialty consultations supported in a single platform, with intelligent routing to the right provider. E-consult and provider-to-provider telemedicine, platforms that enable specialist consultations initiated by primary care providers, reducing unnecessary referrals and improving access to specialty expertise. Remote monitoring at population scale, chronic disease management programs with remote monitoring for hundreds or thousands of patients, with automated alerting and care team workflows. Compliance and data governance, HIPAA, state telehealth regulations, payer compliance, and audit-ready documentation of every virtual encounter across the enterprise. Here are several platforms consistently chosen by large enterprise health systems. Screenshot this list and dive into the links for SelectHub's feature-by-feature comparisons. Links to the SelectHub platform are in the description. There you have it, an overview of the best telemedicine software in 2026, from smaller practices through to enterprise health systems. For more resources, including pricing guides and SelectHub's database of feature comparisons, check out the links in the description. One more big thank you to the sponsors who made this series possible, including our title sponsor, athenahealth, as well as our other sponsors and partners, NextGen, drchrono, CareCloud, and TotalMD. Each of these brings unique value depending on your organization's size, specialty, and care delivery model. Links to book demos are in the description. I'm Devin Hennig with SelectHub. Thanks for watching, and we'll see you next time. Cheers!